Yeah, I think we are live. Yeah. Hi, everyone. Yeah, sorry, there was a bit of a technical glitch. And so here we are on the live video. I'm Dr. Rashmi Manjunath, and we'll be basically trying to bust some myths on acne. We've had, acne is one of the most common problems that as dermatologists we deal with, and also as all of us, because in fact, I keep saying that it is a normal physiological process. The acne has to happen in your lifetime because that's when the oil glands are actually functioning. So that is the thing about acne, and so it is a normal physiological process. We all have to deal with it. Only problem many a times is that how do we deal with it and what happens to it. So acne is many a times not just a skin problem, and that is what we need to understand. It has been published in the American Academy of Dermatology. There's a complete study which has been done that which says acne is not just a skin problem. It can affect the mental well-being. It can cause depression. It can cause low self-esteem, and all that is there. So what is the basic issue? What happens with acne? Acne is basically a problem of, I would not call it really a problem, but I would basically call that it is an issue of the pilosebaceous unit. So the pilosebaceous unit means the hair root, and sebaceous means the oil gland. So the hair root and the oil gland, they open up together into the skin, and when the hormonal changes initiate in the body, which is typically after 10 years, that's when we see the hair root also coming up, the growing up, and then we also see the oil glands to start functioning. And as any factory which starts initially, there has to be literally speaking an oiling issue. So for it to smoothly function, there have to be a few hitches which happens, and that is when these hitches are what lead to acne. So there's a blockage of these oil glands because there's not a smooth movement of the oil secretion to the surface of the skin, and we see that blockage happening, and that can then become more and more, and then lead to marks, scars, and things like that. So where are the areas where these acne come in the body? It happens on the face typically. We see the T zone being very active in some people. We see also in the cheek area. We see in the jawline, which is typically again because of the hormonal changes. Sometimes use of cosmetics and everything can lead to acne on the even the forehead. So there are these are the areas, and again oil glands are present on the scalp. So we see many people dealing with boils on the scalp. It happens on the chest, back, shoulder. So these are the areas where the oil glands are present. And oil secretion is important functionally for us because it has also got antibacterial properties. So we don't want it to over function. We don't want it to hypo function, or not function at all. We want it to function, but we want it to function smoothly, which happens over the years. So the age which we deal with acne is also a very vulnerable age, where there's a lot of body changes physically which is happening. There are a lot of mental changes which are happening, and that basically contributes to and when the face gets involved and the skin gets involved, which is a visible organ of the body, obviously there are issues which we face. So people tend to then pick acne, remove it, use scrubs, use over enthusiastic usage of cosmetics happen, and which can worsen the condition. So and then of course diet plays a role, genetics plays a role hugely. So we are seeing a lot of that also contributing to the severity of acne. So let's say your parents or your siblings have had acne. It's not necessary that you should also have, but if you get it, then you know that they might be what they also must have endured. So we need to basically start working on correcting it. and we cannot really, as I said, we don't want it to completely not function. We don't want it to hyper function. So we have to create that balance, and that's within us, and we can achieve that. um, so of course it's a great time now that people are aware more of what they do, but it's also there is a lot of information which is available for that age group of individuals. And so we see a lot of abuse also of the skin happens, and that is what we as dermatologists have a role to play, to educate our patients in order to use the right products for their skin. We have to understand that every skin is unique. I am unique, you are all unique. So you need to use something which is meant for you. And that is where I, as a dermatologist, would help you out and play a role. So what do I normally like to advise to all my acne patients is, firstly, this would come, it would happen, and we are dealing with millions and millions of oil glands. Just to give you an example, one hair root will have 4 oil glands along with it, and we are talking of literally in 1 square centimeter there'll be around 1400 oil glands. So we are talking of huge numbers here. We cannot really eradicate the whole thing, but we can really control it. We can get it under our control so that it doesn't lead to, it doesn't overwhelm us, it doesn't overpower us, and the healing becomes much more easier for the body also to heal. And so one of the most important tips that I would like to share is, of course, which is the most critical for all body functions, in fact, is to drink water. Now, water is a very, very essential component for all of us. 80% of our body is made up of water. Every system in the body requires water. It may be a neurological system for the proper brain functioning. We know brain contains about 80% water by itself. So most of our water is actually going to the brain. And then we have the complete circulatory system, which is dependent on water. And of course, the excretory system for proper functioning is dependent on water. So, and excretory skin is also an excretory organ. It releases sweat, it releases toxin. So for the proper functioning of the skin, water plays a very important role. It is extremely critical ingredient for all of us. And we have seen, especially in the younger age group, when they are 11, and now because the physical activity is really reduced, we find that the water intake has become really less. One, of course, the body is much more sedentary. So a good tip that I have noticed is to really motivate all of your children to drink water. One of the things that I have included in my daughter's regimen is to pick up a bottle like this, which actually has self-motivating messages. So we can see that it says, let's say, good morning, and then refill again, and then almost finished. And according to her, it has really helped her. And so this is something which you can inculcate in the daily regimen of your children. And if they of course, with or without acne, water is very critical. As we've discussed, it's required for all the systems of the body, proper functioning of the body. So this would really help them a lot. And once the body starts getting that increased intake of water, it itself will start working towards it to get it back. So so this is something which I would like to share. The second thing, of course, is to use good cleansers. So many people say that, oh, I have got oily skin, and I need to use these scrubs and the very, very products for an oily skin, and that so on and so forth. As I said, we don't want the oil glands to not function. We need them to function, but and the more we are abrasive on the skin, it's going to really have an impact. So we would prefer something which is milder, especially when we are dealing with teenage acne. I always say that the skin is more tender, it's still growing, and it's not like an adult skin. We cannot also use products which are meant for a child skin. So we need to pick up products which is appropriate for their skin. Ideally, it would always be better to consult your dermatologist, find out more about the individual skin. But apart from that, just washing face just with plain water or a mild cleanser would always help. The other thing which also I have, advise my daughter, and which she also finds it to be very helpful, is also to use face wipes. So there are a lot of face wipes which are available, which have an oil control mechanism, something like this, if all of you can see. And so these are basically wipes which you can use on a regular basis, and that will help in cleansing. So this is a very good add-on, and which should be included. The third thing which many people also do is to dry up their skin, and that is not recommended. Any acne skin, the body requires moisture. We've discussed about water as an intake, but as a skin by itself, the skin would require lot of hydration, and that hydration will come with your moisturizers. Now again, moisturizers, we don't want moisturizers which is oil based, because then it can trigger up acne, it can lead to that blockages that we've been talking about, and we need something which is gel based. So there are a lot of gel based moisturizers which are available, and it is important that we use that. So they'll have hyaluronic in them, and like something like this is always ideal. It has hyaluronic in it, and hyaluronic basically helps in absorbing the moisture from the environment as well, and it will hydrate. So hydration is also a very important aspect of an acne treatment, and there are a lot of myths around it, that we need to dry it up, we cannot use oil, we cannot use moisturizer, which is not true. So we need to continuously hydrate the skin with gel based moisturizer, and not an oil based moisturizer typically. Then of course we have working on the skin. How do we what do we do? So there are a lot of other things which are helpful, especially working typical antibiotic cream or antibiotic gel which the dermatologist would prescribe. Many a times, many skin have also a tendency of get marks being left after there is an injury or a damage to the skin, and acne is like a damage which is happening on the skin and can of course leave marks. So when we deal with acne management, we always divide it into 3 phases. The first phase is to work on the existing acne condition. The second phase is to work on the marks and the scars which the acne has left, because that's also important to treat. And the earlier we treat it, it's always better. And the third phase is to work on the maintenance, because acne, as we know, oil glands are here to stay. We need them to function, but we don't want them to overfunction. So there will be changes in your life which can trigger up acne. It could be diet, it could be hormonal changes within our body which can contribute to it, and so we need to also maintain it. So people who have acne tendency will tend to get acne also later on, and it is important to maintain it. So this is what we would like to divide it into phases, and every phase will have a different thing which can come up. Of course, we start with a very basic treatment, and then work on the marks and work on the scars, and all of them can be managed. One of the important things that I would like to discuss with that kept in mind is the peels. Now, peels are something which are, it's a misnomer, of course, that it's like, the skin peels, but it's basically an exfoliation of the skin and making the skin rejuvenate. So the dead skin layer is basically removed so that the fresh skin can come out. it has also a lot of other goodness associated to it, because because of the ingredients that we use. So we use something called the AHAs and the BHAs, which also work on the complete pilosebaceous unit. Now the advantage of doing peels is that we work on all the three phases of the acne. So we work on the active acne. We are also working on the what I would say, the complications and the marks which the acne has left. And the third thing, of course, is to work on the maintenance of acne. So all the three aspects of acne is basically being taken care of with the peels. Of course, it's the dermatologist's prerogative as to how they would like to start and for whom they would like to start. If the acne grading is a bit more and it is more severe, which we come to know because of the marks it is getting left, I would suggest definitely peels with complete clinical support, and in the dermatologist clinic with the dermatologist being present. And it is extremely safe procedure, and there are a few post instructions which needs to be followed, like using a sunscreen post procedure, using mild cleansers for 1 or 2 days. These are not procedures which will make you not be going out or restricting your activities in any possible ways. We have reached those times when we have found that everyone, all of us, are constantly working, and with the work from home culture which is happening, we are working all through our lives. So we cannot really be having procedures which will have downtime, and that's how the procedures have also evolved. The other myth regarding these treatments is also which age to start and things like that. Of course, as I said, it is the severity of the condition which will dictate that. If the condition is severe, it is a very resistant condition which is not going by conservative means, then it is always better to do the treatment and have a dynamicity in the treatment, because the skin is a dynamic organ. The environment which we are staying is dynamic, so we need to also address the situation with that sincerity and seriousness. So peels that way are really wonderful, and they will work on all the complete severity of acne is reduced. The marks which the acne has left, also can be reduced very, very greatly. And then, of course, the maintenance of acne, doing a peel once a month or once in 2 months, which will really regulate the skin. So do consult your dermatologist for that. Apart from that, the other thing, of course, is working on your diet. It's very important to have a proper diet. Many a times the myths are that dairy-based products and milk-based products can increase your acne. Of course, too much of it. There is a small study which has been done, but not that that's the only reason for causing acne, but it is primarily that too much of it can have certain implications. Keep a diet which is very well balanced. Junk food, of course, and refined products is always to be avoided. We always try to advise that refined products like sugars, flours, refined flours should be avoided from the diet when we are dealing with acne. So that is another important thing to consider. So using the right products for your skin, including hydrating your body enough, and also working on the diet will be half battle won. And then, of course, working on a specific treatment depending on the severity of condition would really help in managing the situation. So we're very thankful for all the people who have joined in. We can be asking questions also pertaining to the condition that we're dealing with, acne, and we would be happy to take the questions and take it forward from here. So the other condition that we would look at is of course the mask related acne, which is also increasing, and that's when your hygiene factor also comes in. So many when I have a patient with acne, I take some time off to definitely discuss the personal hygiene of the patient. So one of the important aspects is washing your hand. It has been medically proven that washing your hands with soap and not just sanitizing would reduce the bacterial load by even 80%, 99%. So it's very important to wash hands regularly and not touching the face too much, because face as it is has a lot of bacteria, and then we have, we're touching hands again are interacting with lot of surfaces and can damage. So very importantly, don't touch your face too much and wash your hands very regularly. Change your face towels, very important, every day I would say. And then even your bath towels should be changed every 2 days. The pillowcases is again a very important area of contamination, and so that's again something which needs to be changed very, very regularly. And of course the sheet covers and everything. So those are important aspects that we normally try to neglect, and that's what causes. Yeah, thank you for all the questions. Yeah, we are getting great questions here. I'm really happy with all of you. And yeah, madam, any specific diet to be followed? I would say include more of spinach. Very importantly, spinach has a lot of good effects. Also, walnuts are really good. Avocados is again a great supplement to add on. Many people I advise, in fact, take spinach as a smoothie or add it up with beetroot and carrot, which is very high content of vitamin A. So very you should increase your vitamin A intake, because vitamin A is a very important nutrient for managing the skin. So vitamin A is very critical. Yeah, we are getting other questions. There is which are the food we can use to reduce? Yeah, we've discussed it. So more of spinach, more of vitamin A, papaya, watermelon, carrot, all the red and yellow fruits, and water. Water is very critical. Chocolate causes acne. Yes, chocolate. I would say it's a double-edged thing, but yeah, there have been reports medically, is what I'm saying, that because of the high sugar content and the refined products which are used, it can to some extent, but that's not the only reason. And they may have a role to play in reducing your acne by, say, 0.2% or something, but at the end of it, that's important also. So reduction and controlled creating a controlled environment is what is critical at the end of the day. There was a very good question on whiteheads, so thank you, Shweta, for that. How do we deal with whiteheads? Yeah, so whiteheads are the initial areas, I would say the blockage which is happening. First is the blackheads, and then you have the whiteheads which is happening, and those which will so those are what are whiteheads. So we do use firstly, of course, we see a lot of cosmetics causing that whiteheads. People using a lot of scrubs, people using at home based things which are normally used, and that can lead to this whiteheads happening. So firstly, also the makeup that they have. So whiteheads typically are also associated with a lot of cosmetic things which one does. It could be related to a facial, it could be related to even waxing, threading and all that. And so we need to avoid that completely, and using rework on the makeup products that you're using. So probably a change is important. Pick up something which is non-comedogenic. So whiteheads are comedone, so you need something which is non-comedogenic. We at the dermatologist office, we like to first loosen that blockage. So many a times that happens by using certain antibacterial agents, and then of course if they are really resistant, then we do remove them physically at the dermatologist clinic. So it's important, don't pick them at any cost, because they can leave a mark, and they can also increase to the next stage of having a red papule kind of thing. So it's important to control it, and firstly just probably maintain a diary, see what you've had and which could have triggered it up, what you're using, and then change that completely, and then also do visit the dermatologist to get it appropriately treated. Stress causes acne. Yes, definitely stress can cause acne. And then we have vitamin A, which is easily available. Diet is the most important aspect from where you can get vitamin A. All the red and the yellow fruits. And yeah, thank you, Shweta. I hope the answer has been satisfactory. Yeah, can acne scars heal naturally? If you're younger skin, definitely I think there is always a possibility of it healing to some extent, but it depends on the extent of damage which has happened. So in acne scar, what happens, the surrounding skin, which is made up of the ground substance, the collagen, the elastin, which basically give the skin the strength, is what gets damaged. So when the acne is in a inflamed manner, and that causes the ground substance to completely get damaged, and the skin which is it is holding is actually dipping. So that's why we see these depressed scars. So we see a complete valley getting created. And I always tell my patients that when you deal with acne scars, A, you know that the severity of your acne is more. B is that you need to get it treated soon, because as you age, the normal skin collagen also is deteriorating because of the aging. So as we age, the acne scars actually looks more pronounced, and for us to treat it then would be difficult. So you need to really treat acne scars, reduce the visibility of it, reduce the extent of it, reduce the severity of it, and then we can progress. So yes, it does. Irregular periods, yes, for sure, can have an impact. There is no doubt about it, because as we've discussed, acne is we don't normally see acne. We see acne in infantile age and all, but after a certain age we don't really see it till about 10, when the hormonal changes are happening in the body, and there are hormonal receptors which are present in the hair root and the oil gland, which triggers the functioning. And so they have these hormonal receptors, very receptive to any hormonal change which is happening. So yes, hormonal change can have an impact for sure, not just in the early years, in the later years as well. We see a lot of pregnancy associated acne. We also see a lot of menopausal acne. So my oldest patient has actually been 67. So and nowadays with many other drugs that we are on and things like that, there is an increased incidence of acne, drug induced acne, which also happens. So there is definitely an upward surge to an adult onset acne. It's not just a condition of the teenage period. What are the basic skincare tips for preventing acne? Yes, basic skincare tips would be, as we have discussed, one is working on the hydration. It could be also hydrating from within, like drinking a lot of water, but also on the skin per se. So you need to definitely hydrate your skin with gel based moisturizers. Use a very good face, an oil control face wash. Don't think that we need to completely eradicate oiliness. So oil control face wash, using face wipes which are medicated, would really help. Thanks, Aparna. Does dandruff cause acne is a question which is very, very appropriate. Yes, definitely. Dandruff is again one of the changes which happen in the scalp, which are because of the increased oil secretion, because oil glands are present there. And that can of course fall on the skin and cause that blockage of the oil gland. So we do see acne happening, especially on the folds of the face, can around the mouth and of course around the nose, can definitely trigger up acne. So dandruff, yes, can definitely be one of the causes of acne. At what age periods are likely to regularize? So that would depend on person to person. We normally like to see by 15 the periods normally tend to you know become regular, and 15 to 16. Pollution causes, yes, there was an increased incidence of acne happening because, in Delhi when we had the surge of pollution. So we did have that huge thing happening at that point of time, and they were our colleagues which we were in touch with. They said that there's a massive increase in acne happening. We also call it chloracne. It's a term which we use for pollution and the hydrocarbons which are released causing acne. So they cause the blockage. So the external factors of acne can be the pollution, the dust, the dandruff, which is falling on the skin and causing acne. So we have seen that especially in pollution related acne, the face cleansing has to happen on a regular basis, and that's when these wipes and all that can also help you. Constant face washing definitely reduce the incidence of acne greatly. And now we are of course seeing the other variant of it, which is the mask acne, which is basically because of that occlusion of the mask and because of that increased, I would say more of reduced ventilation of the skin, which is also triggering up acne. The sweat also sometimes contributes to it. The bacterial load happening around that area. So constant washing of the mask is very important. People who have severe acne, in fact, I tell them, please use only disposable masks. So all that is very critical. Iron the mask, in fact, and then wear. That's a very important tip which I would like to share. That's also critical. I'm so Komla, thank you for the question, but I think if you can reach out to us uh, somewhere, we can share my email ID, and we can have a personal conversation regarding this, and we would definitely like to help you out. So my email ID is rashmimanj@gmail.com. We'll also try to put it on the post, but that's my email ID, rashmimanj@gmail.com. So do post me. I'll be, definitely willing to help you out to the best of my capabilities. At what age normally acne will come? So we see increased incidence happening around 10 years and above, but no age is exempt from it. And every age has a different, the acne is because of a different reason. So as I've had my youngest patient being, in fact, sometimes even 2 months old, and to the oldest being 67. So that's the thing. So primarily, I think what we are seeing is more teenage-based acne, and we are also seeing more adult onset acne, post 30, 35, 40 also. So yes. Yeah, yes, Komal, that's right. Yeah. So that's my email ID, and just drop me a email and we'll get back to you. Thank you all for taking time off on a Sunday, and it is it's an important topic, and one of the reasons why I wanted to discuss it on a Sunday was primarily because it is also a topic which is very close to our children, and they should get an expert opinion on this, and that is very, very critical. So very importantly for all the children who are watching, please don't be over enthusiastic to use products. Don't get very disheartened when you get 1 or 2 zits. It is absolutely fine. It is a very normal phenomena. They'll come, they'll go, and don't pick them, don't touch your face, don't manipulate it in any possible ways. That is my sincere appeal to all of you. It will be under control. It can be got it under control. Do get an expert opinion. Check with your dermatologist. Very important, to know what products you need to use. and that itself will work really well. And don't forget to hydrate yourself and working on your diet. Keep a close watch and conscious watch on what you're eating, and that will also help a lot. So I think I think we have definitely answered most of the questions. You've also got my email ID. Any questions, please feel free. We are here to help you out with everything which you would want from the skin perspective. So do connect with us, and thank you all for your participation. Thank you. Bye bye. Have a great Sunday, and stay safe, stay healthy.